hospice care. In 1972, Kubler-Ross became an advocate for hospice concept patient care in the home for those that are terminally ill, and brought it before Congress. Although it was not passed when it came up in 1974, she did shed light on what hospice care should be. I personally believe that hospice offers something special, but it's commonly misunderstood. So, what is hospice and why should it apply to you? At some point in your life, you are going to deal with death. And most likely, it could possibly be somebody that is terminally ill. It's important for you to know your options when dealing with the terminally ill. Now, why I believe in hospice? My grandmother died of cancer. We took care of her in the home, and we had hospice, but we didn't understand what it was. So we never really called them until probably 2 days before her death to come and help us. Had I known what I know now, it could have relieved a lot of stress off my family. I also deal with hospice one-on-one with other hospice workers because I do work in the nursing home. And I recently also became a hospice aide. So I get to do one-on-ones with patients that are terminally ill. And it's really nice to be able to sit down and, make them feel comfortable and have somebody to talk to. Some people don't have any family. So that's why it's very important that people do know about hospice care. Hospice is about making moments matter and bringing not only comfort to patients, but also to the family as well. So, what is hospice? We will go over that. The next thing that we will discuss is what are the benefits and when to choose hospice care, what makes up the hospice care team, and then I will share some myths and facts about hospice. So, what is hospice exactly? According to a Saracare Hospice Care Guide, it's an approach to care for terminally ill patients of all ages, providing care in hospitals, nursing homes, and pretty much anywhere that the patient may live. Some of the services that they provide are medical equipment, supplies. They provide the medications that the patients need, as well as pain control. They also provide social services. They provide bereavement counseling. They also provide spiritual care. They provide personal care and other services. They have volunteers that volunteer for hospice care, so they're able to come and relieve the family or just come and sit down and talk to the patients. They also provide respite care, and then they provide continuing care at any time of any crisis. Patients not only benefit, but family benefits as well. They do care about the patient and their family and friends. Hospice focuses on meeting the needs and the wishes of the patient and their family. Some of the benefits, according to www.seniorcaring.com, is hospice provides a familiar environment, which is usually going to be the home of the patient, a sense of dignity. There's no loud machines. There's procedures that they're not going to go through with because the procedures are not going to help them. So they don't have to go through all that pain and suffering because hospice is going to be there to make them comfortable. They have an awesome health professional team. They respect their wishes of the patients. It also relieves the financial burdens on both the patient and the family. they provide the medical equipment that's necessary. So whether it might be an oxygen machine or an air bed or a hospital bed or a wheelchair. They also have 24/7 care. So there's always somebody on call. If something is not right, you can always call them and they'll be right there to help. It keeps the family and friends involved with their care plan or whatever's going on. They include the family and friends if that is what the patient desires. It lessens the family burden and opportunities of growth, peace, and healing. It gives them time to get their personal affairs in order. They don't have to worry about who's going to take care of what. It lets them have some peace to know that when they leave, that not everything's going to be left on the shoulders of their family. So when does a person choose hospice? When there's no care options available, a limited ability of care for themselves, and there's no evidence for further treatment that would be effective for them. So now let's talk about the hospice care team. The hospice care team is absolutely awesome. You're going to find that it includes a medical doctor, which is the leader of the entire team, and then they make up the care plans for the patient. There's an attending physician, which helps with the patient's needs, whether it's, prescribing pain meds or any kind of treatment, and then they help manage the symptoms that the patient is having. They want to keep them comfortable. They don't want them to suffer. There's a social worker that's involved, and they're going to provide counseling, and then they also provide bereavement counseling. There's spiritual care. They provide any spiritual needs that the patient wishes. Some people don't request any. So if that's the case, then, they just come in and stop in maybe once a month to check on them to see if anything else has changed. But if they do have spiritual needs that they need to have met, that spiritual care giver will be there to help them with that. There's volunteers. The volunteers, they do have to take some special classes, but they're there, to give somebody companionship, to support them if they don't have anybody there. Sometimes it's nice to have a volunteer go over and sit with them for a little bit, maybe so the wife can leave or the husband can leave for, to go run an errand or go grab some groceries. A hospice aide, which they're kind of the eyes and the ears, because they do, in most general cases, they spend two times a week with each individual. They're assigned to individual patient, so they will do an 45-minute to an hour long visit. And then on the second one, a lot of times what they'll do is they will help them with their personal needs, such as bathing, changing clothes, washing hair, and then they're also there to provide comfort cares. And then you're going to have your registered nurse that is on the case as well. She's going to coordinate all the team visits, so she'll be the one that assigns each aide to what patient they will have. And then she'll make out a schedule, and then you will have your scheduled days, and that's what the RN will be responsible for. As well as meeting with the attending physician, updating them of any changes that may have happened in their condition. And then they're going to be their primary caregiver. So each patient is going to have a registered nurse assigned to their case as well. The main goal of hospice care team is to provide holistic approach of care and bringing comfort, education, and support to the patient and the family. So now what I'd like to do is share a few myths and facts that are commonly misunderstood when it comes to hospice. One of the myths is that hospice is only available for people with less than 6 months to live. That is not true. There aren't any certainties about life, first of all. So if that person continues to decline in health, then there's no reason that they shouldn't be able to be on hospice because they are at the end of life. There are no more other options for them. So therefore, hospice can pick them up. And then they do get assessed every 6 months to make sure that they, had a decline for those 6 months. And then they'll just keep assessing the situation accordingly. Another myth is that hospice patients are sent to the hospital. That is not true. As I mentioned before, hospice patients are generally, they get to stay in their home. They get to be in that familiar environment that they have. So that care is provided in home, not in a hospital. One of the biggest facts that's heard from patients and family to other hospice team members is that I wish I would have known about hospice sooner. I hope that I have educated you on hospice care, services provided, benefits, when hospice should be considered, who the hospice team is, and some myths and facts about hospice. Hospice care is here to focus on the quality of life rather than the length of life. It provides humane and compassionate care. They want their patients to be comfortable. They want to end their life with comfort and peace. One of the biggest problems with hospice care is that it's not started soon enough. And people think it's only for someone dying and they only have days to live. I wish I would have really known what hospice was and what it could have provided for my grandmother when she was dying. I hope that you can take this information with you and know that there are options for terminally ill and their families. You don't have to do it alone.